Introducing Ronald E. Bachman FSA, MAAA, Bryan University Health Informatics Advisory Board. President and CEO, Healthcare Visions, Inc. Healthcare Visions is a thought leadership firm dedicated to advancing ideas and policy initiatives that are impacting the U.S. healthcare market.
I see the evolution of healthcare information as moving from the realm of the specialists, the experts, if you will, who have shared information from various studies, academic research, to moving to the consumer that is sharing information among themselves and reaching back and finding out from the providers how they can use information around quality of care, choices and options to better benefit them and be able to deal as a consumer more effectively with the actual delivery of care so that you have the improvement in healthcare that's needed so that we can all be productive, contributing citizens. What's drawn me in has given me an interest in informatics and the consumer is that in a real consumer world, you cannot have the individual involved without information. That's one of the critical pieces of any kind of an open market, of good choices. And in my own career, many of my clients have been the big industries, the big hospital systems, the big insurance companies, the big employers. But the real joy in any of that kind of work that I've done historically is trying to figure out how do I actually reach through those large organizations to affect individual lives. That's what kind of gets me up in the morning, what drives me. And what I think this is so important, that information getting ultimately to the consumer is the real key to having a better healthcare system in the United States. I think the consumer, in order to be engaged in any kind of decision making or change of behaviors, needs two aspects. They need information, but they also need some incentives. At the moment, we're typically American that we want financial incentives, but as this ultimately grows, the kinds of incentives of just knowing you're doing the right thing for yourself and or helping your neighbor or other people that you associate with to share information winds up being the internal motivation for doing the right things. So I think that at the end of the day, the consumer will benefit by understanding more about their lifestyle choices, not just what the doctor says you ought to lose weight, but actually working with your community of supporters, your wise men in many ways, your friendship pods, a number of things. We know that that works in other environments that we have experience in. Losing weight. It's easier to lose weight if you're in a group and you're getting reinforced. Alcoholism, changing those behaviors if you're working in groups and reinforcing each other. And I think the same thing will happen more in terms of healthcare issues that we have, chronic and persistent conditions, whether it's diabetes or heart conditions or asthma, that you're able to connect to other people who have similar conditions and not just get the clinical information from your provider, but be able to get lifestyle information that in today's world you just don't get enough time to spend with the provider community that you can get from people who have experienced it as well. All the career opportunities in informatics is just exploding right now. There are tens of thousands of jobs going unfulfilled today. The new companies that are starting up, the whole creative entrepreneurial environment of bringing information to the consumer with all the new technologies is exploding. So there's so many different areas, whether you're talking about information support for providers so that they can deliver care more effectively, whether you're talking about information and data analysis for insurance companies that are trying to find the right kinds of products and information that will lead them to change behaviors, what should be rewarded, what should be incentivized, to specialized vendors out there, best of practices in delivering various kinds of information and services from wellness to preventive care services to disease management services to the technologies that interface and connect the employer, the consumer, the insurance company, and the provider systems out there. So there are so many different ways that people can get involved in taking the data that is now siloed and beginning to bring that together so that you can provide real good quality recommendations on how things should be changed, how behaviors should be changed, whether it's the behaviors of the providers, behaviors of the insurance companies, behaviors of the consumer, behaviors of the employer. That's really what it's all about. It's taking data, creating information out of it, taking that information, understanding the story behind that information to create behavioral change in whatever part of the marketplace you have a specific interest in. Well, I'm very proud to be on the advisory board for Bryan University, because I think that In order to get the kind of support services out there to educate people in this area, to get those jobs filled, those tens of thousands of jobs that are going wanting out there, we need more avenues for people to access the experts, the professors, the teachings. This area is changing so rapidly that using online services will allow an organization like Bryan to refresh itself constantly with new information that's coming out on the areas of opportunity, on new technologies that could be used to do the informatics studies and research. And I think one of the real important parts of Bryan University is being able to do more than just provide the educational materials, but it's to be able to connect people to those industry opportunities so they can have real jobs when they finish the process, so that they'll know along the way what the job opportunities are. You know, it's so difficult for students when there are so many different directions you can go because healthcare is such a big part of our country. Which direction do I go? Which area, which industry should I approach? Which industry should I train for? Well, I think the kind of experience that they would get at Bryan would allow them to have a better opportunity to choose which one really interests them, what gets them up in the morning when they wouldn't otherwise have to, and reaches into what their level of passion, area of passion is.